My Doctor, your health anytime, anywhere. Hello, lovely people. Welcome to the My Doctor podcast. My name is Joy Mwesigwa and I am your host. Thank you so much for tuning in. On this podcast, we talk about health. We want you to live a happy, healthy life. You know, among the things that are supposed to make someone happy and have a satisfactory life is health, money, love. Now we bring to you the health. Yeah. And for today, we're going to be talking about first aid. What do you do in times of emergencies? If you're at home at night at 1 a.m. and your child maybe something happens, they cut themselves and they're bleeding profusely, what can you do to save their life before help arrives? Do you even have the number of the ambulance guy? Do you know any doctor to call? What can you do in that time of emergency that can save a life? Because very many people die because they don't know what to do in that moment. And sometimes it takes just 5 minutes to save a life. So we want you to be empowered and know what to do in times of first aid. So we'll be talking about different scenarios and what you can do. And so today I'm here with Lens. We have been, I think this is our third time here, and we will be discussing this topic with him together. So I'll let him introduce himself.
So what's up, everyone? My name is Lens Mosita Kullie again, and I'm happy to be here to talk about first aid, something that is very important and we actually need to pay attention to because there are several times, especially for us in Africa, we don't have prompt healthcare systems to attend to our needs in time we need them. So sometimes you might be the only one who can be available to help save a life. So some of these basic knowledge we're about to share with you today might be very, very crucial in helping save your loved one's life. Yeah.
Okay, no problem. So as I've told you, we're going to be talking about different scenarios. So we're going to be talking about fainting. What do you do when someone faints? What do you do if they're not breathing? What do you do if they are seizing? We're going to talk about all that. What if they are bleeding? What if they have a fracture? All that. So stay tuned because you don't know what scenario might be coming your way one day. So we'll start with fainting, Lens. What do I do if I'm somewhere and my friend just faints? What is the next thing? What do I do?
So if you're somewhere and your friend faints, fainting is a loss of consciousness for quite a brief period of time. But there are certain interventions you can make which can be very essential to save that person's life. So the very first thing you need to do if someone faints before you is to access if they are breathing or not. Mm-hmm. So you first maybe put the back of your hand to the person's face to feel if they are exhaling or just whatever you can do to make sure that this person is actively breathing. If you find out that they are breathing, that's very good and their pulses are good. You have to tilt them in a way to put them in recovery position. So you put their hands, for example, you put their hands across their chin like this, and then you cross this leg from this same arm. For example, my right leg, you cross it on the other side so that this person stays on that side. Now, that particular maneuver is very essential because it actually helps this patient's airway to stay open and be patent so that they can be in that particular position until help arrives. Yeah.
But it's just sleeping on the side in a fancy way, I could say. Why we do that is because we want the person to breathe, right? So in case I find out that the person is not breathing, what next?
In case you find out that the person is not breathing, like you assess the patient and you find out that they are not breathing, you have to do what is known as Cardiopulmonary Resuscitation, also known as CPR. So basically what you can do is to give maybe 2 rescue breaths at first, or depending on the age of the patient. For neonates and babies, we can say 5 rescue breaths first before we do chest compressions. So for chest compressions, you are going to put your dominant hand on this patient's chest, and then the heel of your palm is going to be placed in the middle of their chest, and then you press like that for about 30 times, and then you administer 2 rescue breaths. If that person is still not breathing, you continue that same thing until help arrives. In more advanced settings, when CPR is being done and the patient is unresponsive, we would actually opt for an AED to check the person's heart and see if their heart is conducting electrical impulses correctly. So yeah, that's what you would do for CPR. Yeah.
CPR, okay. And then for rescue breaths, someone could be wondering what a rescue breaths.
So for rescue breaths, you have to put your mouth. There is what is known as the mouthpiece, the mask. So you put it at the patient's mouth, and then you administer breath. It's almost like you are pushing air in the patient's lungs to help them breathe for them. So you push those air in the patient's lung, and then you do your chest compressions to be able to help save this patient's life.
Yeah, and also if you don't have a mask, you can do mouth. I think they call it mouth to mouth.
Mouth to mouth
Yes, so you just
resuscitation.
put your mouth on the person's mouth and blow like as if you're blowing air into them to risk.
Yeah.
Then you compress, and your hands must be straight in the center of the chest, like Lens has talked about. So now we're going to talk about seizures, and I'll be the one doing the seizures. So for seizures is like there are different types of seizures, but the most common that people know is the one of the jerking. Right? The whole body jerking. So there are many causes of seizures. Could be epilepsy, could be, there's something called febrile seizures. To the mothers watching this, if your child is between 6 months to 6 years and they have a high temperature, they could get febrile seizures. And it's just being caused by the high temperature. We have seizures from head injury and all that. So when you see a person that is seizing, or what they call ensimbo, I think in Luganda, what most people do is they try to restrain the person, but that is wrong. Another wrong thing people do is putting a spoon in their mouth. That is wrong. I'm not going to see why. Now, when you are in a position when someone is seizing, the first thing you should do is remove any dangerous objects around because you don't want them to hurt themselves. And then you put a pillow, something soft, under their head because you don't want their head to get an injury, right? So after doing that, you start timing. Actually, you should start timing the seizure from when it starts. Just let the person be. As long as you remove the dangerous objects, you put a pillow under their head, let them seize until when they stop. And after timing, now some people, they already know maybe they have epilepsy. So even if they seize, they can just take their medicine. But if it's your first time seizing, like it's the first time the person is seizing, or you don't know the cause why they're seizing, or they have seized for more than 5 minutes, or they have gotten an injury, then you have to seek for help. You call for help and take them to the hospital. After the seizure, what do? The person has now stopped shaking. You have to assess if they are breathing like Lens talked about. So you tilt their head and put your hand and feel. Even when you're watching the video, if you put your hand near your nose, you will feel the breaths. So feel if they're breathing, well and good. Put them in the recovery position. If they're not breathing, call for help and start CPR that like we have talked about. So the mistakes people do when someone is seizing is they try to restrain the seizing. Number one, it won't help. The seizure won't stop. The reason the person is seizing is because their brain maybe lacks oxygen. Something is going on in the brain. So even if you restrict them, you have no control on what is going on in the brain. So it won't help. You may cause injury to both you and the person you're trying to restrain because that jerking is strong. Yeah. So you're trying to hold them. They're getting agitated. They're seizing them more. So the best thing to do is to let them be. Yeah, so that's for the seizures. So now we're going to be talking about choking. What do you do when someone is choking? Now, for choking, it's different for different ages. So we'll start with the babies. So for the babies, that's like infants, those toddlers, or like neonates. You'll do 5 back slabs and 5 chest thrusts. Now, for the back slabs, you're going to just, if this is the baby, you're just like doing back slabs as if hitting the back to make sure as you're tilting the baby downwards to make sure what they have swallowed gets out, what is choking them gets out. If that does not work, then you turn the baby and you do chest thrusts with your 2 fingers, these 2 fingers, the index finger and the middle finger, and you just chest thrusts 5. Keep doing that as you call for help. But if it's something that was like near, it will come out. Then for the older children and the adults, there's something called Heimlich maneuver. So for Heimlich maneuver, what you do is you get your dominant hand and you make a fist. And you get this other hand. Now my dominant hand is the right. And then you cover it. And then you put it above the person's belly button and do inwards and upwards compressions. Inwards and upwards. You want to create pressure to take out whatever is choking them. Right? So you do a J motion very hard until what is choking them comes out. As you call for help, for all these first 8 things that we're talking about, make sure you call for help because you never know. It could work, or maybe what is choking them is too big. It has refused to come out. If you called for help, by the time the ambulance comes, at least you've tried your best, right? So now on to fractures. What do we do when someone gets a fracture?
Okay, for fractures, the very first thing is fractures can be defined as discontinuity of a bone you get. So the bone is normally in its own alignment, and then a fracture happens, and they are malpositioned or malaligned. So when that happens, one of the major things, we are talking about first aid. So you are in no position to perform surgery. It hasn't reached to that point yet. So the very first thing you need to do is to immobilize this patient's limb so that you can be able to protect this limb. Because if you don't immobilize, this particular limb is going to swell. There are also other complications of fractures, which may include things like compartment syndrome, several other symptoms. So the very first thing you need to do in a case of a fracture is to make sure you immobilize. As you see in this video, we want to make sure that this patient's limb is not moving so that we don't incur additional damages to the surrounding tissues or skin within a particular region. Basically, that's what you would do as a first aid person in that case of a fracture.
Fractures. Hope you're learning something. So we're going to go on to bleeding. What do you do when someone is profusely bleeding? Even if they're just bleeding, maybe they have cut themselves or they have fallen down or something has happened, an accident. So what you do if the bleeding, let me say this part is bleeding, what you need to do is apply pressure. Depending, if there's no object that's in the bleeding part, then would encourage you to apply pressure to stop the bleeding. If you have any clean cloth or whatever it is, just try and apply pressure. If you're with a person and maybe someone is bleeding, we would encourage you not to touch their body fluids or their blood, because there are so many things that spread through those body fluids. So if you have gloves around, that's why you're encouraged to have a first aid kit at home with some things that we'll tell you about. So if you have gloves around, where the gloves, encourage the person who's bleeding to hold there with pressure or with a cloth, and then you can maybe wrap it up with a bandage and then rush to the hospital, call for help. If there's an object in that wound, don't remove it. What a mistake people make is there's maybe a glass that's in the wound and you're trying to remove it. You're going to cause further injury. You're going to cause more bleeding. So don't remove any object. Try to put pressure around the object or tie a bandage just around the object and rush to the hospital. If it's a simple cut, you can still try to clean it with an antiseptic, maybe iodine or whatever you have at home, and put a small plaster. There are those plasters that you can have at home in the first aid kit. If it's something like nose bleeding, and something people do is trying to take the blood back. Now, you know that that blood could go anywhere. You know, we have the trachea and the esophagus. Yep. The esophagus is what takes your food. The trachea is what takes your air. Now, when you're doing like this, it's like you're sending the blood backward. Anything could happen. That's not the correct way to do it. You're supposed to bend forward, pinch the soft part of your nose, and let the blood come out. When you stop nose bleeding, then you can seek for help, because it's not normal to nose bleed. Maybe unless you had maybe trauma, maybe a kid was playing and someone knocked their nose and their nose bleeding, but you should seek for help. Now, up next, we're going to be talking about poisoning. Yeah. What do you do when you've taken in something that is poisonous, or you're seeing someone, they were fine, now they are frothing? What do you do?
So, in cases of poisoning, what you need to do, you first need to determine what poisoned this patient, because depending on what poisoned this patient, you can be able to think about several things to do. So, one of the major things in Africa, since this particular video is going to people who are home and stuff, you need to make sure you don't force these patients to vomit the poison back, because if you do that, what's going to happen?
Because if they're chemicals, then you're going to cause more burns.
Yep. Yeah. So when if for any reason this patient vomits, make sure you clear the airway. That's it's not being induced. If only if that vomiters wasn't being induced by you, you need to make sure you clear this patient's airway and make sure that they are breathing. If it's in cases of maybe carbon monoxide poisoning or so, you need to expose this patient to fresh air so that they get more oxygen in their blood. So dislodge the carbon monoxide that's within their blood. Then also, if this patient starts having convulsions, what you need to do is, like we talk about in the seizures, don't try to restrain these patients. Allow them to do their convulsions depending on the age. Then when they are done, you can actually put them in recovery position to make sure that the airway is clear and making sure that the airway is also patent in cases like that. There are several different causes of poisoning, and we won't be able to conclude everything in this video, but those are the common things that's done. Like, for example, in my country, in Liberia, when someone is poisoned, they allow them to drink red oil. palm oil, and I don't understand the science behind that. But the very first thing you need to do is make sure this patient is breathing. If this patient is alert, rush to the hospital as soon as possible so that we can make interventions where necessary. Basically, yeah.
And also another thing that can help for ingested poisons is the person taking some water or milk before you get any help. Yeah. And also for the carbon monoxide poisoning, someone could be wondering, how can that happen? You know, people who cook with charcoal in their rooms, an enclosed room, that is very, very dangerous. You'll have even if it's a whole house, I was going to say a single room, but the windows are closed, there's less ventilation, and you're cooking inside the house with charcoal, you could have carbon monoxide poisoning. But if you get such a patient and they're still alive, take them out, let them get fresh air as you call for help.
Do you want to hear a crazy story about that? For carbon monoxide poisoning, several people in Liberia, working in my country, because it's where I came from, several people have suffered and died. There was even a girl, I can't call her name, but she died on her graduation day. Can you imagine? Because she graduated, they had a party, but then you also see those generators that people have in the house. So now they had the generator within the house and the whole house was closed. So there was no ventilation while they were asleep and they died. And the reason, the whole family, can you imagine? And carbon monoxide poisoning is very, very silent. It's not going to be something that you realize and run outside or so. It can be very slow and very silent. So we also need to be very cautious. Make sure that all the smoke generating appliances are directed outside so that you can be able to have proper ventilation for your homes anywhere you are. Yeah.
Speaking of poisoning, I think another thing to talk about would be slow poisons. See, most times we see, there's a lady, I don't know her name, she was on TikTok, she died recently. She was a carpenter or something. And then they said her best friend poisoned her, and it was like a slow poison and what. I think, because now for those poisons, it's a bit complicated. Because there's some poisons people take and they die in 6 months, a year. So I would advise, probably, if you are at home, don't ignore any symptom. If you've been okay your whole life and now all of a sudden you're feeling dizzy sometimes, you have stomach aches, don't take it lightly. Don't just take fragile. Oh, and most people take fragile. I don't know why. Yeah. fragile. Panadol, paracetamol, what? If it's not going away, please seek for help. Just back when they did start, I was at my graduation party. This auntie gave me, trace it back, because it may be hard to notice such poisons, so be vigilant. So anyway, so lastly, I think we'll be talking about burns. What happens when you have a burn? Something has burnt you. Maybe you're cooking, maybe it's cooking oil or fire itself or whatever has burnt you. The thing that you should do is look for running water that is warm. That is in between. Room temperature is also okay. It shouldn't be hot. It shouldn't be cold. Because another mistake people make is getting cold water. It should be in between. Make sure there's running water on that burn for like 15 minutes and rush to the hospital. But if it's a small burn, most people don't like to go to the hospital. Maybe it's just a finger that is burnt. Just put running water. It will help. And make sure you rehydrate, right? Because now these burns, this one, I don't know if it can cause dehydration. But like, the more when you get burnt, you're losing water. Yeah. So make sure you rehydrate, drink some water, and all that. Yeah.
Do you also know another form of poisoning? You know, food poisoning. Have you had food poisoning before?
I have, of course. I think everyone has.
So I think one of the major risk factors for food poisoning is, eating spoiled food you get. And then those foods that have stayed so long in the fridge forever and ever, and then all of a sudden you get hungry one day and you eat it. Yeah, and we're in Africa. There are going to be times where, being able to find food is going to be hard. So most people are actually susceptible to those types of things. But the major things to do is make sure if you are experiencing food poisoning and over vomiting or maybe diarrheating, you are overusing the bathroom, be sure to rehydrate, please. Sometimes you should also try to get maybe an ORS bottle with you. Try to mix it, because whenever you vomit or whenever you over defecate, you actually release a lot of electrolytes. And electrolytes are so important for your health. So make sure whenever you're having food poisoning, always have something to rehydrate next to you, because it's going to be so essential for your health and your recuperation in that particular condition. Yeah.
Speaking of poisoning, I thought about alcohol poisoning. Sometimes I don't know if it's that common. I'm not sure. I think people comment and tell us if you've ever seen someone with alcohol poisoning, but you could be somewhere, maybe in the bar, wherever you're drinking from, and someone just faints, or they are not, or they look disconnected. There's this disconnected that is normal, but they look like they are dying, or like
Delirious.
Yes, they look. Yeah. So what do we do?
In cases of alcohol, one of the major things I've seen, researchers have shown that it's highly incumbent on you to give glucose in alcohol patients. So you should always prioritize, even people who, it doesn't necessarily have to be poison, but if you go and over drink in the night and you're feeling like or really lightheaded and messed up in the morning, it's highly advisable to have some glucose beside you, because alcohol overburns what? Glucose. So you need to replenish that glucose that has been lost. So glucose is highly, highly effective in alcohol poisoning.
Alcohol poisoning. As we come to the end of this episode, I want you to give us some closing remarks.
Okay, you remember the first video we did, and I told you that most of the problems we face with our health can actually arise from things around us. So today I will be switching up that flow a little bit to mental health. What you're not changing, you're choosing. That's a very important statement, and I actually learned it this year, and you need to pay attention to that, because if you are not changing something that you have a problem with, it simply means what? You're choosing it. And it applies to every scenario of life, and it's very crucial for your mental health, because if you want to see change in life, you need to take that step now and make it now. Yeah. What do you have to say?
Thank you so much for my closing remarks. I'll tailor them back to first aid, since we already talked about mental health. For first aid, please, as we talked about all these ways you can help people, make sure the first step actually that we missed out was make sure you're not in danger yourself, you who is giving the first aid. If someone has gotten an accident and they're in the middle of the road and other cars are coming because you want to help and you just run recklessly to the road, make sure you're protected first before you protect that person. I know that may sound a bit selfish, but just protect yourself. Use gloves. There are so many ways. Use gloves. Make sure you're not in danger. Protect yourself, and always call for help before you start resuscitating someone. Before you start helping, call for help. Look at someone. If it's like an accident, you're there, someone is bleeding, you're supposed to apply pressure. Look at a person and tell them, call the ambulance. Do this. Call for help, because all these things, for someone to become healed and become better, they have to first go to the hospital, and further management is done. So this first aid episode was for the first things you do before you reach medical help. So make sure after what you've done, you seek for medical help. Otherwise, thank you so much for watching this episode. Thank you for tuning in. Hope you have learned a lot about first aid. We want you to be in charge of your life and the life of your loved ones in terms of health. And those 5 minutes that you take to save a life, to do that first aid, could be the thing that saves that person's life. So make sure you get these things and do them as they are, and also make sure you seek for further help after that. And also, we have telemedicine services in Uganda. Actually, the next episode is about telemedicine. What is telemedicine? It's your ability to reach a doctor from your phone, using your WhatsApp, a website, using telephone numbers. So that, because sometimes you forget how to do these things that we've talked about, but if you could call someone in that time for help, that would be nice. This is the My Doctor podcast. My Doctor, your health anytime, anywhere.
My Doctor, your health anytime, anywhere.